What is physical therapy? I know some people have no idea what it is. Other people have a lot of idea what it is, and a lot of people have experienced it in different ways. So, just to give you a little background, physical therapy is really designed to help people improve mobility, strength, flexibility, decrease pain, overall with the goal of improving and restoring function. So whether that means a shoulder that's out of alignment, that has tightness and weakness and pain, whether that's a spine that's out of alignment, that has a lot of pain and different tightnesses there, or whether it's somebody who has a difficult time walking and needs to return to function with walking. All of it requires returning and regaining the function that somebody once had. And that's, in a nutshell, what we do as physical therapists. So if you have an issue that requires physical therapy, typically what would happen is you would have a conversation with your doctor. Doesn't have to be, though. You can call a physical therapy office yourself and initiate the treatment yourself. But typically most people will talk to a doctor about an ailment or something that's bothering them, whether it's a condition that sent them to the doctor or whether it's something they happen to talk to them about at a regular appointment. And I see that a lot. And then they talk about the possibility of, would physical therapy help this? So that's usually how it's initiated. And then usually once they get that prescription for therapy, they would call an office and set up an appointment. So what that means then is then we evaluate that patient based on what they're coming in for. And when we evaluate them, we're doing a comprehensive evaluation. We're looking at strength, we're looking at range of motion, getting a good history of why they're having the issue they're having, how long they may have been dealing with it. I personally will look at their other activities that they were doing prior to it, activities that they want to get back to, and different goals that they want to meet. So a lot of times once we do the evaluation, we will establish goals as physical therapists as to what we're trying to accomplish. Improve range of motion to a certain degree, improve strength to a certain degree, be able to do a certain functional task. All of these things designed to help people get back to the activities or the function that they're trying to do. But the other thing that most of us should be asking, and I will ask all my patients, is what are their goals? What do they want to be able to accomplish? For a lot of them, it's very simple. They just want less pain. They want more strength in their arm or their leg, or they want to be able to move better. For others, it's they want to be able to get down on the floor and play with their grandkids. For others, it's they want to be able to put their kids on their shoulders and go for a hike. So it's all different based on each individual, and that's how I approach it, because I think that's the most important way to do it. Is we're all different people, so we all have different ailments. I could have 10 people with the same exact knee condition, and they're all going to be different needs. They're all going to react differently to the treatments, and they're all going to react differently to how they rehab and recover from that. So each person's an individual, and it should be looked at that way. So if you go to therapy and they're not really looking at you as an individual, and it's more of a cookbook approach where, here's the 5 things we do for a knee, here's the 6 things we do for a shoulder, doesn't matter who you are, what you're dealing with, I would recommend you find somewhere else, because that's not the best approach. The best approach is looking at you as the individual and what it is that you need to accomplish and what it is that you're looking to get out of physical therapy. And that's where the best benefit happens. So if you need therapy, I would definitely have a talk with your doctor if you want, or if not, just call an office and set up an appointment with them and have them do their evaluation. Once we evaluate, then we establish the plan of care, which is going to typically be anywhere from 1 to 3 times a week on the average, to seeing people for about 4 or 5 weeks and reevaluating things and see where we need to go if we need that long. Sometimes we need way less than that. Sometimes we need a little bit more than that. So it all depends on the individual. And then we reassess as we're going through each session that they're in here. And then hopefully accomplishing the goals that they want, accomplishing the goals that we want, and sending them on their way with home exercises and other instructions for them to continue with their process, with their rehab after they're done. So that in a nutshell is what physical therapy looks like. So if you don't know, now you do. If you did know, then again, I would encourage you to make sure that if you need therapy again, try to find out a place that can really focus on you as the individual, that's a little bit more thinking out of the box, that's a little bit more engaged in different ways to do things, different ways to do exercises, and hopefully you have success.